Hi, everyone. I'm Frank Malakote. I work as an anchor and a reporter at KTVU Fox 2 here in the San Francisco Bay Area. My guest is the CEO of NURX. It's a leading telehealth company based in San Francisco to talk about birth control and COVID-19. There's a lot of chatter about after sheltering in place, perhaps we'd have a baby boom. Maybe not. Let's say hi to their CEO, Varsha Rao. How are you?
Hi, Frank. Thank you for having me today.
Good to have you as well. Before we dive into the so-called baby boom, why don't you tell us more about NURX and what you folks do?
Sure. NURX is the leading telehealth platform with a focus on sensitive health. So we focus on birth control, emergency contraception, PrEP, which is for HIV prevention, as well as STI at-home testing, HPV at-home testing, and herpes. So all of these areas, which traditionally have been a little bit sensitive, are the areas that we focus on. And we do it all from your home. So we offer this end-to-end service where you can go online, input your medical history, and we'll give you a consultation and diagnosis. And then we can actually write your prescription for you. And then you can actually get it delivered right to your home if that's what you'd require, if that's what you'd like. And so you can have an end-to-end experience without ever leaving your home.
What about, is there a doctor involved in all of this, or how does that work?
Absolutely. So we have a number of providers who are licensed across all the different states that we operate in, which is over about 30 states in Washington, D.C. And these providers will look at your medical history and then determine whether you are eligible for whether it's birth control or herpes medication or whatnot.
Okay. Well, we both have some Boston connections. You grew up outside of Boston. I worked there for a quarter century, believe it or not. We know what nor'easters are. They come and they wreak havoc and everyone stays home and hurricanes and that kind of thing. And there's usually a baby boom after, at least the long ones. But a lot of folks thought while sheltering in place, especially in the early months, that maybe by the end of the year or the first of next year, we might have a baby boom here. But according to your sales and what you folks have been doing, delivering birth control, that might not be the fact, right? Tell us about that.
Yeah, so, I think this has been a time of incredible uncertainty for everyone around the country. And so what we have seen from the beginning of COVID to now is about a 50% increase in women typically requesting our services. And so that is something that we think, we've been working to ensure that we can provide that access. And when we think about the deeper reasons for that, I think there are a few fold. One, of course, there's, again, a tremendous amount of uncertainty from an economic perspective in terms of what's going to happen from more of a macro environment and more close to home, from an unemployment perspective. Women are overrepresented in terms of some of the unemployment rates. They are also often in service roles that have been really hardly hit. And so, a lot of women want to take extra caution around family planning at this time.
I bet. And I would imagine there is some trepidation about even going to a hospital nowadays with COVID-19 as well, right?
I think that's right. So I think there's a couple things. So both from a pregnancy prevention perspective, as well as just even going in to see your provider, a lot of the reasons patients are coming to us, we hear from them and they've shared with us that they don't feel comfortable going in to see a provider because they want to make sure that they are avoiding areas where they could contract COVID-19. So from a just, making sure that you are sheltering in place safely, keeping out of areas where you might have a higher risk. That's one reason why a lot of patients have been coming to us. Similarly, they've also seen going to the pharmacy as a potential area of risk. And so that's why a lot of patients have chosen to use our service, because we offer that end-to-end experience where you don't really have to go to either of those environments.
And I would imagine some women out there being pregnant during a pandemic, that would be a pretty scary endeavor, I would think, just because you've got a number of appointments. You're going to have to leave the house, in other words.
Yeah, I have two kids, and there's a lot involved in pregnancy, and it's a wonderful experience, but making sure you're staying healthy and you're getting to going to get your checkups, and your all the prenatal care, which is critical, and providers are an important part of that, and most often it's done in person. So I think patients are just being really cautious about all aspects of their healthcare during this time. And we want to just, we feel really grateful and humbled that we can be a part of helping to support women during this time.
Do you think that will change, though, as we get a little further along? Lord knows when that's going to happen. We're still in the first wave, and we can't seem to get out of it. But I would think that would change. It'd shift. At least we hope.
Well, I think we all certainly want more clarity and more comfort in being able to go back out into the world from a COVID perspective. What I think is interesting is coming out of COVID, there's a dramatic, we've already seeing survey data that shares that there's a dramatic increase in trust for using telehealth and telemedicine as a result of having to use it during this period of time. And so what a lot of folks are saying is that telemedicine is going to be more of a normal choice, a first choice, as opposed to something that historically might have been a second or third option. And I think that, players like NURX, like ourselves, and probably others will all, continue to see increased usage. And, for our perspective, we want to be a part of this healthcare ecosystem in a way that's most valuable for patients.
I was speaking with someone earlier in real estate that sells office space here in San Francisco, and he felt the same way. He goes, years ago, we wanted to work from home maybe one day a week, and our bosses were a little reticent. But now I think it's, not that the pandemic's been good by any stretch, but it certainly has changed the way we work. I'm at home, you're at home right now, and it looks like Zoom calls and Skype and that kind of thing are probably here to stay, I would imagine.
Yeah, I think when you think about it, the healthcare system was pretty overwhelmed even before the pandemic. And so, post-pandemic and after COVID, if telehealth can be more a part of the solution that helps to alleviate some of that overburden for the traditional healthcare system, I think that's a positive for everybody. And so I think that's where someone like us, I think, can be helpful.
Okay, very good. If somebody wants to get in touch with NURX, how do they do it?
You just basically go on to the website or the mobile app. It's www.nurx.com. They go online, they fill out their medical history, and we validate that, and then we'll do a consultation. Our process is actually asynchronous, so our providers look at all that information. If they have any questions, they will message you back and forth, and then otherwise we will kind of move forward and provide you with the prescription that you need, and then you can kind of go on your way.
Sounds great. Varsha Rao with NURX, she's CEO. I want to thank you for joining us this afternoon here in the Bay Area.
Thank you, Frank.
All right, Varsha, thank you. I'm Frank Malicote. If you'd like more information, you can always go to coronavirusnow.com. Have a great day, everybody.